Hi guys, and welcome to the Live with Nikki show. So we're having um, technical difficulties here this morning. We're trying to get Dr. Granite in the show with us so that we could talk all about adrenal fatigue. He is joining us from Chicago, so um, we are just waiting for him to join, and we are going to be talking about adrenal fatigue and what that means for moms and women in general, and how that affects all of us, because I don't think that enough people know about it, and it's something that I've suffered from. So I know that I've talked a lot about IS recti. So a lot of people, they think, oh, why do you have a mommy belly? And when you have, belly around, fat around your belly. Hold on one second. Let's try to get him on. When you have fat around your belly, a lot of times it is from adrenal fatigue. Hold on. Just trying to get him on here. Just bear with me, guys. This is a good live, so we hope that you all ask comments and questions and tune in. And Dr. Granite has, like, I don't know if you guys saw the other post, but Dr. Granite has an approach to medicine that's different than a lot of Western doctors. A lot of Western doctors typically like to do a band-aid approach, and they don't get to the root of a problem. And they just like to throw medicine at you, and they don't really look at what is causing or the dysfunction in the body, which a lot of Chinese medicine focuses on. So, one second. I'm going to introduce him in a second, but if you guys have any questions about weight loss or weight gain or health issues that you're suffering from, hopefully we'll have Dr. Granite on again in the future. Let's see if we could get him on here. We had technical difficulties this morning. We've done this before. I don't really know why this is happening. Hold on. Ooh, look how bright I am. Hope all of you guys are doing well this morning. It's almost Friday, which is very exciting. Okay. I don't know what's going on, guys. So I wanted to talk, if those of you that are just starting to join us now, and let you know that we are talking all about adrenal fatigue. Dr. Edward Granite, a doctor based out of Chicago, is going to be joining us. We're just trying to have some technical difficulties. Hi, Jill. Thanks for joining us today. And Dr. Edward Granite is going to be talking about adrenal fatigue and why moms get burnt out, and if you do, what you could do about it. A lot of it leads to high cortisol levels, and it has belly fat around your abdomen. So, like I've said, I've suffered from IS recti. And I also, I was asked recently last week while traveling if I'm pregnant. And so, no, I'm not pregnant, but I do have a pooch. And the reason why is because I have high cortisol levels. I'm burnt out. I'm probably not taking care of my body as much as I should. I like to run around and do a million things. I'm running Pink and Blue. I'm doing consulting as well. When you don't take care of your body, that's what happens. You kind of, let's see. So when you don't take, you kind of get burnt out, and then you're running on low. And no matter how much diet and exercise you do, according to Dr. Granite, isn't going to help your belly fat. Oh, there's Dr. Granite finally. Woohoo! He's on. He'll be joining us in 1 second. I see the box come up finally. Oh, you love
Can you?
technology, guys. Hi, Dr. Granite.
Oh my gosh, this is
How
such
was
a
that?
perfect
That was
topic for adrenal fatigue and stress.
yeah,
This was awesome.
a little stress this morning. Thank you for
Yeah, I
joining.
apologize. I'm going to be holding my phone, so it's going to be a little all over the place
Yeah, it's
because I
okay.
wasn't set up.
You can let it lean against
Okay.
something on your desk if you want.
Yeah, let me see.
I
Let me
just
see
have
if I
mine leaning
can
against my
do.
computer. So
Okay,
thank you
let me
for
just
joining
see if I.
us. So he's just positioning his camera, but doctor,
Yeah.
you're sideways now. Just put it the other way. Put it straight.
Okay. Yeah. Okay. Hold on.
Yeah.
Oh, what? There. Okay. All
Yeah,
right.
that's good.
Okay. It's okay. Don't even worry about it because I'm holding this in such a funny way. But it's
Okay,
all
no
good.
problem. So
This
Dr.
is.
Edward
Oh my
Granite
gosh.
is based out of Chicago. He actually studied your undergrad was in Toronto, right?
Yes, I actually studied in the University of Toronto. Yep.
Right. And then you went on and you went to Chicago after that? How did you wind up
Yeah, I
in
was at.
Chicago?
Yeah, well, it's actually a funny story to that. So I have Eastern European parents who said you're growing up to be a doctor no matter what. So
Right.
I was actually in pre-med and I got accepted into dental school, but unfortunately I was not able to afford to go to dental school. It was in Boston at the time, and the tuition was just crazy. And a friend of mine. Couple of weeks before we were graduating, I bumped into him like, "What are you gonna do?" I said, "I can't go to school. I don't even know what to do." He's like, "I'm gonna be a chiropractor." I'm like, "Chiropractor? What's a chiropractor?" He's like, "It's a doctor." I said, "It's a doctor."
No.
Good. It's a doctor. What does it do? What does he do? And I said, he explained to me what it does, and then I went to chiropractic school. So I was never gonna be a chiropractor. And then, interestingly enough, in my first year of chiropractic school, I got into a plane crash. And that really showed me what chiropractic was all about because they wanted to do surgery. My left leg was almost completely paralyzed. And they wanted to do surgery on me, and I refused. And I had to take a year and a half off of school.
Hmm.
And chiropractic and acupuncture has actually got me back on my feet. So that's where I really started to understand the value of things. But that was still very far away from understanding all the effects that this kind of stress was having on my system. So that's kind of how I got into the whole chiropractic thing.
Okay. And so as I was explaining when I was going on and off the lives, and probably people in the group now because I don't know how to share it to the group from here. I'll do it afterwards. But um, so I was trying to explain to people that a lot of doctors that are Western doctors don't really focus on getting to the root of a problem. They're really focused on the band-aid approach and throwing, especially in the States, and I'm from Florida, so I'm American. Shout out to all the
Yeah.
Americans out there. Um, and if you all would like to know, I'm Canadian and American, so don't get you're in.
Yeah, me too.
Yeah. So, um, I think that a lot of doctors like to throw medicine and pills at a lot of things. And for those of you that don't know, and I was telling you, Dr. Granny yesterday, is that I have a lot of health issues, right? So I suffer from migraines, I have Crohn's disease, I have ankylosing spondylitis in my spine. I've also suffered from adrenal fatigue, but a lot of doctors either they don't believe that there's really a problem because well, you look fine, or um,
Right.
or they just dismiss what you're trying to say. I went to the doctor, a recent story, and I said I maybe you could answer this with adrenal fatigue, is that my glands always get really swollen before I get my period. And
Yep.
so I said, but I thought at this time it was different. I thought I had strep, which a lot of adults don't get strep. And she said to me, "Well, your quick strep test came back negative, and I just want you to know that, now we finally figured it out. You have chronic fatigue. So I'm going to call, your other doctor, and I'm going to tell them that, we figured it out. You have chronic fatigue." 3 days later, it comes back that I have strep. So I think that a lot of doctors, they don't really get to the root of the problem. And part of, learning about what you do and connecting with you, the thing that really sparked my interest is that you get to the root of the problem of what patients are going through. So can you talk more about your approach?
Yeah, definitely. So just like you, I came from a lot of health problems, and I also went through the experience of going to doctors and the doctor saying, your blood work seems fine, so you must be fine, and so here's some antidepressants for you, and have a nice day. And I'll answer the question about your strep, how that relates to adrenal fatigue. And so I had to go out and learn things for myself, nutrition-wise, and blood work and all those kinds of things to try and fit the pieces together because I went through a period of time where I went through such a significant stress that I couldn't eat for 3 years. I could only eat soup for 3 years. And so I had to do something for myself. Otherwise, I didn't know where I was going to wind up. And
Right.
so my approach right now, when patients come in, this is actually called, it's a functional medicine approach. And more doctors are actually waking up to this approach. And this approach actually looks at you as the whole person, because you notice when you go to a doctor, they pass you from doctor to doctor. So nobody really looks at you as a whole. So this
Story
doctor
of
says,
my life. Story of my life.
right?
Yeah.
It's so frustrating. They're like, oh, this is outside of my specialty, so I'm going to send you to this doctor. So let's say you come in with a symptom like you were saying, you have, swollen glands. So they'll look at you and say, okay, if it's not swollen glands, then it's not my problem anymore. I'm going to send you to this doctor. And then
Hmm.
that doctor looks at your digestive system, let's say, well, your digestive system is fine, so that's not me, so I'm going to send you somewhere else. And each time you keep getting passed and passed on like this, you're like, I mean, nobody's figuring it out. And even worse, some of them say they'll find something, and now you're on 4 different medications for 4 different symptoms.
Hmm.
And so my whole approach is to say, hey, why are we just treating the symptom? Let's take a look at the whole body. So what we do is we do a specific, more specific testing to see what systems are actually going offline. So in the case of adrenal fatigue, since this is what we're talking about, a lot of patients will present with such, a variety of symptoms, and it's different for everybody. And so what my job is to say, hey, I think that this may be adrenal fatigue. Now, I have to go and do some blood work. So what kind of blood work am I doing? I'm looking at things in the blood work for uh, cortisol imbalances. This is one of the major hormones that you need to pay attention to. I'm looking for things like if you're a woman, I'm looking to see if your other hormones are out of balance. And this starts to give me some kind of indicator as to what might be going on. Your minerals might be out of balance. And if doctors are not taught how to interpret these kinds of tests, then they may miss the whole point and they're like, oh, just your minerals are a little out of balance, you're completely fine. So in functional medicine, we have to make sure to go to the root cause by doing specific kinds of testing and then recommending lifestyle changes, not just dietary changes, not
So,
just giving a person.
so going backwards because we kind of jumped the gun with my story, but what is adrenal fatigue for the people that are just joining us, and what is the cause of adrenal fatigue?
Okay, so basically, it's the breakdown of your system that handles stress. So
Okay.
you basically just become burned out. So there's a system in our bodies that's designed for survival, that's designed to make us run away from danger, right?
So it's a
But
fight or
we,
flight.
exactly, right?
Right.
The problem with that is that system was created thousands of years ago, right? So in today's society and where we live, our stresses are completely different than they were thousands of years ago. Before, we were running away from a saber-toothed tiger, but then once we ran away, we
Right.
had time to rest. We had time to recover.
And
Today,
yeah, sorry to
go ahead.
interject. So that's like the O, like we were talking about the blood types. Like O blood type were hunter and gatherers, and they had the fight or
Yes.
flight to respond to that stuff. So like I don't know if all of you guys remember from psychology class or medicine, when you studied science, that's something that we all learned.
Right. And so what happens is when you have this prolonged stress like we do, so the saber-toothed tiger today is, the bills you can't pay. The saber-toothed tiger is your kids, acting out in school, behavior problems. The saber-toothed tiger is a
Right.
divorce. It continues, and it's like, but the problem is all these. I like to give my patients an example. It's like you keep leaving these apps open, right? So your mind is constantly going, and eventually the computer system, your system becomes bogged down.
Hmm.
So stress is very accumulatory, and so if you don't do something to take it out, your system ends up burning out. Unfortunately, and I don't know in the perceived future if this is going to happen, our system has not gotten the update. Our genes have not evolved to handle the kind of stress we live in today. So people end up burning out. And what that means is your body stops being able to produce the hormones that are responsible to handle stress. Things like adrenaline and things like cortisol. Those are I'm not going to go into the intricacies of all the different hormones, but that's what people understand. So those hormones become off balance, whether there's too much of them or too little of them, then we start to develop specific kinds of symptoms. And at the end, when this becomes very intense, a lot of people experience out, which is, and so, did we just get cut out for a second? Because
Yeah,
I
it
got
was
a
cut
little
out
pause
for
on my
yeah,
phone.
yeah.
Okay, so what I was saying is, so that's when people burn out. So there's about 20,000 visits to the medical doctor for people who experience fatigue. I mean, this gets to a point of where you can't get out of bed. People come in, they can't do a simple task, like it's a chore for them. This is probably an indicator that you may have something pretty wrong with this system. So it's because of the accumulated stress that we're not used to taking out of us. It could be chemical stress, nutrition, things that we're breathing, emotional stress, loss of a loved one, which, by the way, it's 1,000 times more powerful than physical stress and chemical stress. So emotions play a big part when we have adrenal fatigue. So this is why it has to be a multidisciplinary approach to try and clear this problem. You can't just take a medication to get out of it.
So, some doctors, Western doctors, like my doctor sent me to an endocrinologist, and I felt like
Yes.
my thyroid was off, which is related to the adrenals. My
Yes.
thyroid is kind of borderline now, but they were saying, no, we don't, there's no such thing as really adrenal fatigue. If you want to go to a naturopath, you can. Hi, Kelly. Hi, Jill. Hi, Andy. If you guys have any questions, be sure to ask Dr. Edward Granite. We have him for a little chunk of time, so we have to use his knowledge. So, is there proof or research? I mean, why don't Western doctors treat this, and are they able to, or they just don't know enough about it? I mean, what's your take on
Yes.
that?
So I think, I always say, don't blame the doctor, kind of blame the system. And it's what's being taught, I think, across medical schools, but a lot of doctors are waking up to it. But I think we have to use the right terminology. So there is a lot of documentation for adrenal fatigue, except that's not what it's known for. It's very easy to explain adrenal fatigue to a patient. You tell them,
Okay.
your system that is responsible for stress is burned out, and there's these two little glands that sit on top of the kidneys, and they're burned out. And the patient understands that. The patient gets that. But when we're talking, if you want to speak the lingo of the medical doctor, the research, it's more on a system level. So it's basically called an HPA axis dysfunction. And what that basically stands for is hypothalamus pituitary. That's the part of the brain that actually controls everything else in your body, including the adrenal glands. So if you call it hypothalamic pituitary adrenal dysfunction, then the doctor will say, oh, okay, I get that. And if you actually go into PubMed, which is a big research kind of thing on the internet, and you punch in adrenal fatigue, you might get under, I don't know, 20 papers. And it's still not proven. But if you go and punch in HPA axis dysfunction, you're going to get over 20,000 papers. So if your doctor doesn't believe that you have this dysfunction, you just have to explain to them that it's HPA dysfunction. And then he'll say, oh, okay, now I understand what you're talking about. So yes, there is a lot of research. And to go a little bit deeper, this is why this has such reaching effects inside your body, because you said your thyroid was like out of balance, and then you went to an endocrinologist. So we have to understand that this disorder can affect so many different systems in our body. And for me, for instance, it affected my digestion, because when we're stressed, we can't digest our food, right? And so for somebody else, it could be a thyroid problem, because too much cortisol in the system will put the thyroid offline, because the thyroid is basically the brake that looks out for anything, says, uh-oh, there's something wrong. Let's slow things down so we don't burn out. And so when you understand that how other systems interact with everything, you understand how someone can experience so many different symptoms when they have adrenal fatigue.
So my question is twofold. So you mentioned digestive, which I'm going to get into because somebody has a question about it. But the other question that I have for you is because it sits on top of the kidneys, I also went into almost kidney failure. My kidney, I was born with it anatomically turned. And I had to have kidney surgery, like a pyeloplasty, which most people aren't going to relate to. But because it sits on top of the kidneys, could it affect the kidney?
It's unlikely because they're kind of two separate systems.
Okay.
It's like if you said, the lungs sit on top of the stomach and the lungs affect the stomach. Yeah, I guess you can make a connection that if you're not breathing right, then you're not getting enough oxygen to the stomach, but not in the way that structurally that they would affect one another unless there's some kind of a tumor growing off of the kidney and pushing on the adrenals. Do you know what I mean? So if there was some
Right.
kind
Okay.
of
So,
pressure on the adrenal glands structurally because something is wrong with the kidney and it's pushing on something, then possibly yes. But as far as, function goes, they have two separate functions.
okay. So another question, which might be more relatable to the audience that somebody had. So Jill asked, is it common to have adrenal fatigue with Crohn's disease, which I also have Crohn's? And if so, how do you treat it?
Uh-huh. Okay, so is it common to have a better question? When you get adrenal fatigue, meaning because cortisol is very influential onto the immune system. So when that hormone starts to get off balance, it affects the immune system. And then if the immune system gets affected, it can start to attack our own body, which is kind of like what Crohn's disease is, right?
Right.
So yes, adrenal fatigue can affect different kinds of autoimmune disorders. Crohn's disease is a very severe kind of disorder. So I can't answer in two questions how you would treat that, but the main thing that I tell my patients is patients don't give enough attention because they want to come into the doctor and they want a pill or they want a supplement or they want like this 1, 2, 3. What do I do? It's good to get that, but unless you really go in and do work yourself on taking this stress out, whether it's meditation, whether it's prayer, whether it's going outside for a walk and just disconnecting yourself, it's taking time for yourself, which most, especially moms, don't get to do anymore. And when they come in, they're running on empty and they still have to do all those things, but they can't do it because they haven't scheduled that me time where they de-stress. Have you ever seen like shows where like there's like it's a cop show or a police show, and then they after some stressful event they bring them in and they debrief them?
Right.
Have you ever seen that before? So
Yeah.
this is the same thing, right? When we have a stressful event, and we have them so many times a day, we kind of need these de-stress, but we don't do it enough. So the first thing that I would say is like just something simple. You don't even have to go anywhere. It's just breathing techniques can work so amazingly well for de-stressing you, right? And what I have my patients do when they're breathing, I really have them notice a state. Like I say, on a scale of 0 to 10, how stressed do you feel? It's very important because that's when people start to become in tune with their own systems. See how stressed you feel and where do you feel the stress? Like, is it in your chest? Is it in your stomach? See where you feel it. And then when they get more in tune with their body, they start to be able to tell that they're actually stressed. Say, when you notice that, start to do whatever breathing technique, whatever meditation. And after 10, 15 minutes, again, take a check and see where you're at, like 0 to 10. And you'll be surprised what 5, 10 minutes of just focusing on your breath can do for stress.
Right.
So that would be a great thing that you can do.
I mean, and something you guys know, like people that have been following me, that I'm into crystals. I have crystals all over my office.
Oh, that's awesome.
I have this from Sage, um, and it's a peppermint oil. So it's just like a stick that my neurologist told me to get. So it's a roll
Oh,
on and it's peppermint.
yeah,
I mean, these are little things. It's just sitting on my desk right in front of my computer. So whenever I'm stressed, I roll it. Like
right.
these are little things. And my sister is like asking, does it mimic bile acid malabsorption?
It can, okay, so that's actually what happened to me. So it can have an effect on your digestion because when we're stressed, we're in fight and flight response.
Right.
Our body's not worried about digesting food. Our body is worried about pumping blood to our muscles so we can get away. That's why we feel the tension. That's why we feel this kind of like hollow feeling in the stomach, kind of like when you're hungry and you didn't take enough food. It just doesn't feel right in there. So it can definitely mimic bile acid dysfunction. And that's exactly what I had. And so I have to take, even now, I still have to take digestive enzymes. So it's important to sit down, not watch TV and all that stuff that we don't do, not important not to eat on the go, just to really take some time, get your system more relaxed, and then start to eat.
We're just cutting out for a second.
Sorry, I lost you for a second.
Did you, like, how did you change your diet for that?
When I first started out, I actually did the worst things I could possibly do because I didn't know any better. So obviously I was eating soup, and then when we go to restaurants, I'm like, I can't bring soup with me. So what I would do is I would eat a ton of fruit, right? Because my body could digest it, and so I'm like, okay, great, I can do fruit. So I'd literally bring these big bowls of strawberries, and my friends would laugh at me because I looked normal. They're like, you're really weird,
Right.
okay? So, and I would eat fruit. And next thing I know, like 3 months later, I almost became diabetic because fruit is, with adrenal fatigue, cortisol, this we'll get into weight loss and weight gain about that. Cortisol is a hormone that makes you gain weight. And if you eat too much sugar, you're going to off balance that system that controls sugar. And then the adrenal glands, which are also responsible for maintaining blood sugar when we're not eating, have to go through an extra stress of trying to maintain that. But if that mechanism is already broken, that just puts an added stress on your system. So I had to figure out that yes, fruit is good for you, but it has to be at the right time. So through a lot of trial and error, I started to seeing what my system could handle, and it was a lot of smoothies, it was a lot of juicing, but not juicing from fruit. It was juicing from greens. I made some disgusting juices, but I have to say, people could not drink them, but I didn't care. They were making me feel better because my body stopped being able to absorb anything. I couldn't take a single supplement without reacting to it because that's how damaged my system was. And so, what my system could handle is natural food. So I always like to give my patients real food before I pack on any kind of supplement. So it was a lot of smoothies, it was a lot of juicing. Then eventually, when I found the right combination of digestive enzymes, I started adding in protein. Anytime I ate like bread and pasta and anything to do with gluten, I didn't know it at the time, but it was throwing my body into such brain fog. Like I'd be standing and talking to somebody and they'd be like, "Are you listening to me?" I'm like, "I'm trying to listen to you," but I literally must have appeared to them like I wasn't even paying attention to them because I couldn't understand what they were saying. I could hear them talking, but such brain fog, and that's again your immune system reacting to everything that's going into your